Today we will be talking about atrial fibrillation and antidysrhythmic medications. What is atrial fibrillation? It can be defined as irregular ventricular rate without visible P waves. What this really means is that in atrial fibrillation the atria chambers of the heart beat fast and irregular due to improper electrical signals. This chaotic rhythm causes not enough blood to be pumped out, leading to blood pooling in the atrial chamber as shown in video. Pooling blood can clot, leading to an increased risk of blood clots that can cause strokes and heart attacks. Signs and symptoms of atrial fibrillation: fatigue, fluttering or thumping in chest, shortness of breath, faintness or confusion, sweating, chest pain. Important to determine that chest pain is not from heart attack. Seek emergency care. Sometimes AFib may not show any symptoms at all. Risk factors for atrial fibrillation. Atrial ischemia means not enough blood is getting to atria, could be due to plaque in arteries or extreme cold. Inflammation. Advanced age. Older than 65 years of age. Alcohol and illicit drug use. Neurological and endocrine disorders. Genetic factors. High blood pressure. Heart disease. Antidysrythmic medications indicated for atrial fibrillation and other dysrhythmias of the heart. Antidysrythmics are indicated for treatment of different types of dysrhythmias, which are irregular heartbeats, like AFib. Atrial fibrillation is caused by unsynchronized or incorrect firing of electrical impulses to the heart. Antidysrhythmics offer two different ways of correcting AFib: rhythm control and rate control. Rhythm control works by helping to restore and maintain normal sinus rhythm, whereas rate control works by helping the heart maintain a rate within normal range of 60 to 100 beats per minute. On this medication, it's acceptable for the heart rate to be 110 or lower. The classes of antidysrhythmics for rhythm control are Class 1 sodium channel blockers and Class 3 potassium channel blockers. The classes of antidysrhythmics for rate control are Class 2 beta blockers and Class 4 calcium channel blockers. Classes of antidysrhythmic medications. Class 1 is the sodium channel blockers. These drugs work by preventing sodium from getting through the cell membranes, which in return slows down the electrical impulses of the heart, reducing contractibility of the heart muscles to help maintain a normal heart rhythm. Examples of these drugs are disopyramide, flecainide, matrophenone, propafenone, and quinidine. Class 2 is beta blockers. Beta blockers work by blocking the atrioventricular AV node and hormones, like adrenaline, which then slows down the heart rate and maintains it by reducing the electrical signals passing through the AV node of the heart. Examples of these drugs are acetylbutylol, atenolol, bisoprolol, metoprolol, nadolol, and propranolol. Class 3 antidysrhythmics are the potassium channel blockers. These antidysrhythmics work by preventing potassium from going through cell membrane to the heart muscle. This slows down the heart's electrical impulses, reducing contractibility to help maintain a normal heart rhythm. Examples of these drugs are amiodarone, bertilium dofetilide, dronedarone, abutylide, and sotalol. Class 4 antidysrhythmics are calcium channel blockers. These antidysrhythmics work by blocking calcium channels in the heart's muscle, decreasing the contractions of the heart muscles, therefore decreasing the heart rate. Examples of these drugs are diltiazem and verapamil. The expected drug outcomes for antidysrhythmic medications is that they will correct dysrhythmias by changing electrical impulses being delivered to the cardiac muscles, resulting in either normal sinus rhythm, a controlled rate, or both. Look at diagrams to the right. See how the heart pumps more effectively when in normal sinus rhythm compared to AFib, which has more chaotic electrical impulses. Adverse drug reactions of antidysrhythmic drugs. Hypersensitivity, also known as allergic reaction. Nausea, vomiting and diarrhea. Dizziness and headaches. Blurred vision. Potential to lead to more dangerous arrhythmias. It's important to reach out to your provider if you experience any of these effects. To be more specific, let's talk about adverse effects of the different antidysrhythmic classes. Sodium channel blockers adverse effects are hypotension, dizziness, bradycardia, rash, and QT prolongation. Beta blockers adverse effects are bradycardia, hypotension, AV block, heart failure, and alter blood sugar causing hypo or hyperglycemia. Potassium channel blockers focusing more on amiodarone have adverse effects of Pulmonary toxicity, thyroid disorders, QT prolongation, SA node dysfunction, and AV block. Calcium channel blockers have adverse effects of bradycardia, constipation, heart block, difficulty breathing, and hypotension. If you experience any of these effects, reach out to your provider. Antidysrhythmic toxicity or overdose. Antidysrhythmic toxicity can affect the heart, circulation, and the central nervous system, so it is important to adhere to medication regimen prescribed by provider to help prevent this. Symptoms of toxicity are nausea, vomiting, neurological symptoms like confusion or seizures, and fatal arrhythmias. There is no antidote for antidysrhythmics, however. There are medications used to combat these symptoms and manage the overdose, drug-drug and drug-food interactions. Many patients on antidysrhythmics are on warfarin to decrease risk of blood clots, but warfarin can increase INR lab value by 50%, meaning your blood is not clotting properly, putting you at risk for hemorrhage. This lab value is critical to monitor when on both of these drugs. Grapefruits and grapefruit juice should be avoided because they can inhibit the breakdown of the antidysrhythmic medications. If combining antidysrhythmics, watch for signs of an interaction such as bradycardia or hypotension. Check to see if there is an interaction between any antibiotics, antifungals, or bronchodilators you take in your antidysrhythmic medication, as these drugs could cause prolonged QT intervals which could lead to fatal arrhythmias. Black box warnings. The black box warning for quinidine is increased mortality related to QT prolongations causing irregular and possibly fatal heart rhythm. Torsade de pointe. Flecainide has an increased mortality or non-fatal cardiac arrest rates with prior history of heart attack. Propafenone, dofetilide, and sotalol can have a proarrhythmic effect, which means this medication could induce a worse arrhythmia. Dronedarone has a warning about risk of death, stroke, and heart failure. Amiodarone has a warning about liver toxicity, lung toxicity, and proarrhythmic effects. Antidysrhythmic pregnancy categories. Class B, lidocaine and sotalol are Class B, considered safe because there was no risk to fetus in animal studies, but human studies have not been conducted. Class C, most antidysrhythmics are considered Class C pregnancy category, meaning that studies in humans were not conducted, but in animal studies there was shown to be a risk to the fetus. Class D, amiodarone and esmolol were considered Class D because evidence shows risk to fetus in pregnant women.